English to Spanish translation, and that will be conducted by the very fabulous Mariana Rivarola. So thank you so much, Mariana. If you want to just let folks know in Spanish that translation will be provided.
Yeah, hello. Hola a todos y bueno, muchas gracias por estar aquí. Van a poder escuchar en el idioma de preferencia, según como aparezca un globo abajo que dice language, idioma, y ahí pueden seleccionar español, Spanish. Gracias.
Gracias, Mariana. All right, so perfect. So we're going to get started. I'm just going to let folks know that we are having a two-part session here. We're going to have a brief presentation from the LSP Promotoras, who I'll introduce shortly, and then we will finish off with a panel, which will be done Q&A style, moderated by Griselda Correa. So thank you everybody for joining. Just really quick to introduce the promotoras that we'll be having today. We will have Montserrat Salas, who started in 2019 as a youth promotora, and in 2020 has continued as a youth promotora lead, and is now in the community engagement coordinator for LSP and Latino service providers. So thank you, Montse. Connect when you can. I know you're having a little trouble with audio, but thank you for joining. Melissa Nieto, we also have today. So Melissa started in 2019 as a youth promotora and also continued on in 2020 as a youth promotora lead. She's in her third year of the program as a promotora and is placed at Verity. So thank you for joining us. And then lastly, but not least, we have Jess Martinez, who started in 2019 as a youth promotora and as well in 2020 continued as a youth promotora lead and is in her third year of the program as a promotora and is placed at the City of Santa Rosa Community Engagement Office. So thank you ladies for joining us. We will, just so we don't forget the rest of the folks, Dr. Gonzalez will briefly introduce the panelists that we will have at the later time. So Doctor.
Yes, well, thank you very much for being here on Tuesday after the Dia de la Raza, that President Biden finally declared that is the day of the natives in this continent, and not the day of Cristobal Colón, that was a bloody murder. So today we have an amazing group of people that I've been following for a while. They've been working so hard for years, but they have a lot of good information to share with you. And we will start with the three or four promotoras. I have deep respect for promotoras because I work in other countries with promotoras and they really make a difference. Their community really trusts them. I work with promotoras that they didn't speak Spanish actually in Mexico, and it was amazing. That was the only way we can reach those groups in the community. So again, we have an amazing time, and I really appreciate that you're taking the time. Please send any questions because we probably can answer. The panelists can answer. If we couldn't, then we find a way. And eventually we'll contact you and answer because that's the way we operate. So thank you again. This is the 29th Latino Health Forum, and we are so happy to have you. We're in the middle of the pandemic still. Not the middle, we are having a pandemic problem. So very pertinent information. Thank you and welcome.
Hola.
Okay. So.
Okay. Gracias, doctor. Thank you so much. Did you want to quickly introduce our speakers that we said? Carissa, Javi, Seth? Or I'll go ahead and introduce our next speaker. So for our panelists, we will be having Carissa Moreno, who is the Executive Director for Northern California Center for Wellbeing. So she grew up in Marin in Sonoma County and has extensive leadership and experience in community health. She's been advocating for equity and social justice and has always been at the forefront of who she is and what she does. So thank you, Carissa, for joining us. We will also be having Javier Rosales. So most recently, they held a dual role of project director for La Plaza and the Cura Project. Javi is originally from San Francisco, but has been living in Sonoma County the past 9 years and plans to make Sonoma their permanent home. Welcome, welcome. Throughout their life journey and travels, they realized we are all social beings. To build, love, to create, to live, we need each other. So thank you for joining us today, Javi. We will also be joined by Stephanie Manieri, who is the Director of Programs at Latino Service Providers. Stephanie is a native to Santa Rosa and grew up in the southwest part of town and has strong roots in Sonoma County. She's committed to addressing public health issues in her community and hopes to continue motivating more young people of color to pursue community leadership roles. So thank you so much, Steph. And last but not least, we will have Jenny Fish, who's a family doctor in Sonoma County and co-founder of HPeace. Jenny came to Sonoma County in her residency through the Santa Rosa Family Medicine Residency and graduated in 2012. Family medicine is, as we all know, a vehicle through which she follows her diverse passions, including humanism in medicine, primary care, and public health intersections. So serving the underserved both locally and globally. So thank you to our wonderful panelists. And I know we have a lot of speakers today. So last but not least, we will be having our community health advocates here, Angeles Quiñones and Sabina Gonzalez, who are both community health advocates that work alongside Cura Project and other community promotoras to make sure that information regarding COVID-19 vaccines and vaccine access are well accessible to the community by providing education and awareness through tabling efforts. Both Angeles and Sabina have been doing community health work and advocacy well before COVID and have so much to share with our community and systems. So thank you all for having us. And after the lengthy introductions, we are going to get right into our presentation with the LSP Youth Promotoras. So I will let you two take it away, and you are welcome to share your screen to share your slides. So,
could I get access to turn my video on?
you should have access now, Monse.
Thank you.
All right, whenever you ladies are ready to present.
Perfect, thank you. Are we presenting the slides now?
Yes, please.
Melissa, I can help present the slides.
Thank you. All right, good evening, welcome, and thank you all for being here. Today, my colleagues and I will be presenting about a youth participatory action research that we, along with the Executive Director of Latino Service Providers and two Sacramento State University faculty members have conducted in the last year. The research project aims to explore the ways in which Latinx youth ages 14 to 24 in Sonoma County thrive during major life stressors over the last 3 to 5 years. Reimagine resiliency. Slide, please. Next slide, please. Thank you. My name is Melissa Hernandez. I am a psychology major at Santa Rosa Junior College, and I am studying my 3rd year with Latino Service Providers as a professional promotora. My first year being a youth promotora and my 2nd year being a youth promotora lead.
Good afternoon, everyone. My name is Montserrat Salas, and I have been with Latino Service Providers, formerly as a Youth Promotora and then a Youth Promotor lead, and now currently as Community Engagement Coordinator. And I graduated from Sonoma State University with the BA in Sociology and in Liberal Arts.
Good evening, everyone. My name is Jessica Martinez. I've been with LSP for 3 years now. First year as a Youth Promotora, then as a Youth Promotora lead, and currently as a Youth Professional Promotora. And right now I am majoring in radiology at the San Jose Junior College. I'd also like to acknowledge that one of our research partners, Sarai Hernandez, is not here with us today due to a family emergency. Sarai Hernandez has also been with LSP for 3 years now. First as a Youth Promotora, then as a Youth Promotora leader, and now as a Professional Promotora, while also being a student at Sonoma State University. Next slide, please. This study is significant to my colleagues and I because it allowed us to be in a professional role to serve our own community, giving us the chance to listen in on Sonoma County's youth's voices in these unprecedented times. As we navigate the challenges ahead, students' voices must be central to the way community support is reimagined. Next slide.
Next slide, please. This Youth Participatory Action Research Project was launched in November of 2020. And by March 2021, we had been trained in research methods and received IRB certification. By April, we started data collection by interviewing our 14 participants, ages 14 to 24, all residents of Sonoma County. Next slide, please.
You may be asking yourselves when looking at the slides, what is a nodal theme and how did they come about? So a nodal theme for the purpose of this project and represents a major concept and sometimes a reoccurring subject that reappeared in the analyzed data that was collected. When synthesizing and analyzing the data, 3 major nodal themes were identified, and under those 3 main ones, we also found sub-themes, which are the ones you're seeing here. The first nodal theme identified was stressors and challenges. For fires, evacuations, and COVID, our participants experienced negative mental health impacts due to feeling a constant go mode. And they also had to be fully alert as a result of the wildfire season in California. COVID-19 also led to an increase in feeling isolated and distressed because things changed rapidly, and many participants experienced forceful adaptations. The second nodal theme is mental health and well-being. Our participants described that their mental health was impacted by many factors going on throughout their lives. A lot of participants experienced feeling overwhelmed and anxious. They also resonated with feeling that years of their lives had been stripped away from them having to miss on important events such as graduation, family reunions. The third and last nodal theme is racism, immigration status, and language barriers. Our community members experienced racism as a minority, and this led to them feeling unsafe in their own communities. Our participants also stated that there was a level of disconnectedness and lack of resources for community members were not distributed fairly. Not having legal status also prevented individuals from accessing much needed resources.
The second category for our nodal themes is coping. The first theme is family. In most Latinx communities, family is a significant aspect of our culture. Most of our participants had the ability to quickly name someone significant in their life who supported them during the pandemic and other difficult moments. As one of our participants stated, and I quote, "My mom has always been a good support. She's a very good mother. When I feel frustrated or want to vent, she's always there." For many families, our shared experiences allow us to connect and create a sense of loyalty and belonging, allowing us to rely on each other. The second theme is community connection. A key part of being a human is socializing and connecting, whether that be with our colleagues, our friends, and our family. However, socializing is something that the Latinx youth struggled with. Although many socialize by volunteering, having a connection to their community, and by simply supporting each other during these hard times, a majority of our participants highlighted the need for increased socialization. After a year of distancing themselves from friends and family, Many mentioned that they would like more opportunities for community connection. The final theme is self-care. We are constantly occupied with delegating our day-to-day responsibilities. However, through this research, we found that many participants coped with the challenges they faced by practicing self-care. This pandemic opened up the opportunity to learn new ways of self-care that helped many maintain their physical and mental health. As one of our participants stated, and I quote, "I feel like just being by myself and like going outside has been the best in terms of me getting away from my computer." Self-care really allowed the participants to further strive through their daily lives while in this pandemic with the specific restrictions. Next slide, please. Oh, wait, no, sorry.
Okay, thank you. There are also 3 nodal teams that our participants want community leaders to know about. The first team is targeted outreach and material for Black, Indigenous, people of color communities. We are not just talking about translated information. We are talking about culturally appropriate delivery of information and access to resources. Our community members want to relate to someone who understands their cultural background and can provide support integrating this fundamental part of who we are, because we are not being supported in the way that we deserve. The second major theme is community building and awareness. Most of us seek connection, and our participants highlighted that during this pandemic and other crises that have happened in the last couple of years, their need for connection increased. As one participant said, and I quote, "I also think it would be nice if they will have services that provide community building. Community building activities where people from around the area get to know each other," end quote. Most of our participants were able to name someone in their life who helped them during this pandemic and pointed out that people who thrive and handle stressors better are also people who ask for support and are able to rely on others. The third and last major theme is the access to services. We are talking about free or low-cost services and access to those services in various languages. Our community needs mental health services, focusing on culturally appropriate therapy and support groups. Our participants highlighted the need for virtual and academic support because during remote learning, they were all at different levels of disadvantages. This includes access to electronic devices, internet connections, and a space dedicated to learning. Lastly, our community needs financial assistance, job opportunities, food and transportation support, because we are constantly being presented with barriers that add up to our struggle during already difficult situations. Next slide, please. Thank you. At this point, we want to acknowledge a study from which we drew inspiration from, and that is the Youth Truth Survey released in Sonoma by the Sonoma County Office of Education, where 30,000 students, parents, and guardians and school staff were surveyed on different topics such as academic challenges, school culture, emotional and mental health, and some key findings were experiences of relationships, belonging, distance learning, housing needs, and the impacts of local environmental disasters. This and other research studies have helped us understand some of the challenges Latinx youth are experiencing, but there is little data available that focuses on the supports and systems that have helped them to cope and thrive during this challenging time. In other words, we were presented with some problems, and we wanted to dive deeper and find the solutions as to how our youth are overcoming these challenges. Next slide, please.
As Melissa said, so some study highlights that we learned from our research and also from other data trends are when the Latinx youth of Sonoma County face challenges like fires, COVID-19, or racism, their resilience stems from having a strong connection with their families and also their community, as well as having a natural desire to overcome obstacles from learning from their experiences and having the will to not give up. Significant discovery that we also found was help community leaders better understand the Latinx youth and provide guidance to pivot approaches and target resources, and also improving lives. With the new understanding of the problem discovered through key research trends in our own research, you may be asking yourselves, so what? Why does this matter and why is it so important? I'd like to take this moment and invite you all to think of this and what you'd like to do with this information. Next slide, please.
The call to action of this research is to get you all started on thinking about what you can do for the youth. And I'm sure many of you are doing something. Today, we would like to share what LSP is doing. LSP has a youth promoter internship, which consists of 3 different tiers. The first tier has 5 different tracks. The tracks consist of the Promotores de Salud, which focuses on ending the stigma around mental health. Promotores Preparados, which focuses on emergency preparedness. Promotores Verdes, focusing on environmental justice and climate change. And lastly, Promotores de Vivienda, which focuses on housing issues and concerns. The second tier is the Youth Promotor Leader, which assists in supporting the youth promotores while also working closely with the program manager. And lastly, the Professional Promotores, focusing on networking, building professional skills, and implementing those skills in an agency in partnership with LSP. And through this project, LSP allows youth to voice their opinions and needs. This research is important to us, not only because it's coming from our youth, but also because it's relevant. With these research findings, we encourage all community leaders and organizations to 1, create safe spaces where families can come together, whether that be through family get-togethers, pláticas, charlas, anything that brings culture, people, and food together. 2, although many of us may share the same language, culture, or traditions, we all have different struggles and needs. As one of our participants expressed to us, and I quote, to understand the community, and allowing them to voice their struggles and their opinions because we're not all the same. Lastly, we want to create inclusivity. And through taking these steps, this will allow us to come together and create a reimagined resiliency. Next slide. To conclude our presentation, we would like to open up the space for any questions that you may have.
Perfect. So if anybody from the audience would like to submit a question, you can do so using the Q&A feature at the bottom of your screen. And you can also use the raise hand option at the bottom of your screen to ask a live question. So please go ahead and submit any questions you have for the promotoras. That would be great. Perfect. So we will give it a minute for folks to submit some questions. In the meantime, I did want to ask the promotoras, I know you're talking about a lot of the findings that you found and doing this process, and do you want to talk a little bit more? I know you touched on this briefly, but do you want to talk a little bit more about just the process and how it might have changed your perspective or changed the way you had initial thoughts of what your findings were going to be and something where it was a little bit different? So anybody want to touch on that?
Yeah, I will actually like to touch a little bit on what you asked us about our perspective, because we didn't include it in this presentation, but at the end of the interviews that we had, the 2 faculty members from Sacramento State University actually interviewed all 4 of us and then included that data in another analysis. But it was eye-opening, to say the least, seeing how many problems our community are facing, like our community is facing with not just the pandemic, the political climate, and the fires, but also with other issues that we don't really think about on a daily basis, but they have huge impact on our community members.
Yeah, definitely. I can definitely imagine how this process just like completely, gives you a new perspective. But we did get another question right here from somebody, and just anything that surprised you maybe in the research. Anybody else want to answer that, Jessica or Montse?
I think for me, it would be that teens wanted more connections, because I think at times a lot of youth can be hesitant towards wanting to, being connected and like kind of engaging with older adults, sometimes because we don't feel like we're heard. So kind of just seeing that, how they really wanted that, and especially during the pandemic, I feel like is something that we all should pay attention to, just because I think everyone needs a little bit of connections now. And I know, right now we are starting to, but just kind of, it's a great way to get to know each other more, and just, your neighbors and stuff. So I think that was the most surprising for me.
Same as like Jessica and what Melissa were saying. I think for me, the biggest, lesson learned from this opportunity is, resiliency stems from hardships. And, I learned that it won't make problems disappear, but it definitely can give people the ability to see past them and finding coping mechanisms and ways to handle stressful situations, to live a more healthier life.
No, definitely. And that's like a really key detail we'll actually talk about later on for folks who are interested. In 2 days, we will have a workshop with Richard De Leon from Hannah Institute, who will talk a little bit more about resiliency within the Latinx community and how that has just like created like a huge wave in terms of community building and community activism, and how that has impacted these different sections within different organizations and stuff. So really excited for that. And then I will say, perfect. I know you all mentioned a little bit about the process for actually doing the research, and this might just be a smaller piece of the bigger picture, but I did want to know a little bit about the IRB process and wondering how that was like. I know I, work in research and higher ed, and I know that IRB is something that a lot of people dread to do because it's a very long and tedious process. And I just wanted to know, like, what did you learn from that, and like what, how was that like? Because and for a lot of people that don't know, it's kind of intense. So yeah. Anybody want to answer?
I would like to share my experience. So this is actually the first research project that I've been involved in. And like I mentioned before, we started in November of last year. It's gonna be a full year, next month. And we thought that it was gonna be a shorter process, but once we got into the IRB training, we did our own training. We did it on our own, but it took hours. We received, I believe it was 4 certificates at the very end, but each single certificate had like at least 2 hours of work into it. And then once that was done, we submitted the research project and all of our certificates and documents. And it took even longer to get a response. And then we had to like update the research project. We had to like explain some things into like more detail and then have to submit it again. And then that's when we got approval to start doing the interviews. It was a long process, but I truly enjoy it. And just seeing what goes into doing research when it involves community members and like being ethical about it, like it was just really enjoyable.
I would say for me, kind of bouncing off what Melissa said, it is very tedious, but I feel like I got to learn throughout the process. Like there were different things that I didn't know, and since it was also my first research project, I feel like, maybe in the future, when I need to do another research project, I feel like I already know the process. So it's kind of just like, it was a chance for me to, learn new things and kind of fail and figure out how to better myself for the next time. So I feel like that was like a good benefit for me.
Same to what Melissa said. It was definitely a long process, but it was so worth it in the end. And we, even though I'd done it before, I still learned a lot of new things the second time around.
Yeah, definitely. I know I usually will work with students in higher ed, and that is a very, like you said, tedious process because there's a lot of training involved. And for those of you that might not know, I know you all briefly mentioned it with IRBs, the Institutional Review Board that basically makes sure that your research is that involves human or animal subjects is done ethically. And so, it's great that these precautions are made. And I just want to really give, I know we're just virtual, so we're not going to hear an audience clap, but I really want to give you all a round of applause for doing that and doing all that work that goes behind it, you know, as youth, right? So it's a lot, but thank you so much. We're going to take another question from somebody we have here. Someone's asking, based on your research, besides translating, how can attendees further support Indigenous populations, and how can hospitals or local clinics better support their clients and meet their needs?
Yeah, thank you for this question. I really think it ties up to the next panel that we're going to be having. Like, I feel that having promotores, community health workers in such places can really benefit our communities, whether they be Black, Indigenous community, people of color communities, because they know the culture. They know they advocate so strongly for people's needs. And I strongly believe that having community health workers in those places where people are getting medical help, support with other resources, or having access to those resources is really helpful.
I think it also, like, kind of basing off that, I feel like the connection that we have having those community health workers and then working with like any doctors or just nurses or somewhere, you know, in a clinic, I feel like helps just because the community health workers are able to provide that resource, like Melissa said, where we're able to provide that resource and then kind of work together and meet the needs that, you know, Indigenous populations might need, or people of color might need.
I would also just like to quickly add, you know, community voice is there. And a lot of times, you know, our own community is telling us, you know, what the critical needs are. So I think if we continue to pivot and listen to them, you know, we will be able to meet their needs and also provide the much needed support that is needed in populations that we haven't, you know, expanded to.
Awesome. Thank you, ladies, for sharing. It looks like we have someone who wants to ask a live question. So Celeste, get ready to ask your question. I'm going to unmute you briefly so you can ask our lovely panelists. All right, Celeste, you should be able to ask your question if you are on. All right, I'll give you 2 more seconds before we move on. Okay. Oh, well, I lost the chance. No worries. If you have a question that you want to ask live, go ahead and raise hand again, or just use the Q&A feature at the bottom of your screen. That will also work. But yeah, thank you so much, ladies. Do you have any last minute you know, words you want to say to our audience? I know you kind of mentioned a little bit of a call to action. Do you want to repeat that for anybody that might have missed that before we move on?
Yeah, of course. So just like a call to action, just, you know, we just encourage you guys to really connect with the community, find a space, wherever that is, wherever that safe space is for you, create inclusivity, and just come together and try to convivir. I socialize in a sense in English, sorry. And just have these conversations, just because these conversations are something that are important to happen. And I feel like once you set that conversation, you know, we're able to make different changes and see what types of solutions we can make when it comes in terms of, you know, the needs of the community. But if there are any questions, we would like to thank you guys for your time and allowing us to be here today. And if any questions do come up after, feel free to contact us. Contact any of the participants or any of our colleagues and teammates. Our information is right there. You guys can take a picture of it if wanted to. But if not, then we would also like to acknowledge that this project wouldn't have been possible without the help of the 2 Sac State professors, Heather Diaz and Anna Suleiman, and of course, Lupe Navarro, for allowing us to have this opportunity to do this research project. Thank you.
Thank you so much. Sorry, I was briefly muted. We will now move forward to the next part of our presentation. So give me one sec. I will allow everybody on briefly. So we will add everybody now. Okay. All right, it looks like we're good. Let's see. I think we have
We are missing Angeles y Sabina.
Sabina. I'm finding Sabina. Here you are, Sabina. Perfect. So the next part of our lovely presentation today will be a panel with the folks that we mentioned earlier in our introduction. So we have Carissa Moreno, Stephanie Manieri, Jenny Fish, Javi Cabrera, Angeles Quiñones, and Sabina Gonzalez. And this will be moderated by Griselda Correa. We will be doing a panel where you know, they'll be answering some questions posed by Griselda, but of course, if anybody has questions while they are already talking or presenting, feel free to throw them into the Q&A or use the raise hand option, and we will try to get to them when we can. So I'll hand it off over to you, Griselda.
Perfect. And I thank you so much for handing it over. And I want to give a huge shout out to our Promotores from Latino service providers to really getting us in the room and really sharing your knowledge and your findings with us. And also a huge thank you to Latino Health Forum for allowing us this space and always having community at the forefront of everything you all do. So thank you so much. Y con eso, good afternoon, muy buenas tardes. My name is Griselda Correa. I have had the great pleasure of working alongside all of my colleagues and dear friends here on the screen and many others, some of which I've actually met through the pandemic and have never met them in person, which are the unique ways that we now function. I also want to acknowledge that as we are moving through and you're probably eating lunch with us and or listening in or multitasking, I want to invite us to take a few breaths just to get us in the room. And we always, you know, I'm used to like entering space with music. So I was just jiggle it out a little and kind of recenter myself to be better present with all of y'all. So with that, I want to address and acknowledge that in the presentation given by our Youth Promotores, we really heard what our community was entering the pandemic with while still healing from other natural disasters. And the healing continues. It hasn't stopped. And wanting to acknowledge that and call out, right, that the two things that really stood out for me in the presentation, and that I have seen many of our community partners advocate time and time again for, is linguistically and culturally appropriate information to the community to be better prepared for whatever disaster is coming our way. As we continue our discussion for today from our panelists, we will hear on how they have responded to yet another disaster and continue to have community at the forefront of everything that they do. So with that, I'm actually going to pose a question, and I would like to invite Jenny, Javi, and Stephanie to kind of help us get in the room, because I have had the pleasure of working with all three of you since the beginning of the year and even before, but really kind of got more close-knit this year. Can you please give us an overview of the collective that has come together to meet the urgent needs in response to COVID and the inequities that are being experienced both now and before?
Yeah, I don't mind starting, Griselda. Thank you. So just to frame the conversation and the question a little bit, like Griselda mentioned, and like our the promotoras reminded us of, there were health inequities and social inequities already in our community before the pandemic started. And so really what we saw when the pandemic began to have economic impacts, social impacts, is that these inequities were just exacerbated. They became bigger and they were really highlighted throughout the course of the pandemic. And so what we saw as a community-based organization at Latino Service Providers and with our partners who were doing their best and doing our best to respond to the needs in the community, is that there was an increased burden of COVID-19 infections and pandemic consequences in communities of color, and that was the problem. And so, as community-based organizations, who our mission is to respond to the needs in our community, we set out to see how we could elevate those needs, elevate the voices of the people who are doing on the ground work. And I will let my colleagues, Jenny and Javi, speak to that if they like to. And we tried to really come together as organizations and work collaboratively to respond to these health inequities. It wasn't an easy task. It's work that continues to this day. And I'm happy to go into that a little bit more. But I'm wondering if Jenny or Javi, there's anything you'd like to add to the framing of this question.
Yeah, what I can say is that I think one of the most amazing things that happens during disasters or during urgency is community coming together. And so I think all of us saw all of these different spaces where decisions were being made and strategy was being made. And I think it's really important for all of us to understand that our institutions, so this includes our health centers, this includes public health, this includes all of the tables where decisions are being made. If things are done in a way that doesn't focus first on the most impacted communities, inequity will continue to be maintained. And that's what we see playing out. So the biggest question is who's at the table, right? So if we do not have BIPOC folks, community health workers, lead organizations that are working with those communities at the tables in more than a tokenized way, then inequity is going to be the result. Because as we've heard, community knows. And the truth is that community is going to do the work to serve community, regardless of whether there's funding, regardless of whether institutions are there. But what we really wanted to do as we're bringing, as a lot of groups came together to do the work, is how do we actually support the people on the ground? How do we focus all of our advocacy in a collaborative way to really support the community health workers, the promotores, the people that are on the ground doing the real work? And then how do we utilize our advocacy, because many of us were in a bunch of different spaces. How do we utilize our advocacy to push the systems to actually support the folks on the ground? And so I think that has been probably the most powerful and beautiful thing that has, as Stephanie said, that like really came up and continues. This continues every week for hours, is how we're coming together to support community and really focus based on what the community is saying. Javi, do you want to add more?
Yeah, thank you, both of you, and everybody for sharing. The other aspect that I'll add, and I would love for Stephanie after that, if you want to share a little bit about the COC, is that the importance of how we continue to collaborate is essential. Is that when we're talking about not only our local communities, but as a county as a whole, we can't necessarily put the weight of a particular challenges and impacts due to COVID in this moment on the back of one organization or one community group to be able to handle this. The reality is that we all, and sometimes very differently, depending on the neighborhoods and the areas throughout the county, our needs, our wants, and the ways that we thrive is very different. And so through partnerships and making sure that those partnerships are getting the needs, not only monetary and making sure that the funding is available, but also the additional resources that it takes to build the capacity, development and leadership aspects of advocating for when things are needed. There may be something that's needed today that wasn't really clear or framed yesterday. And so making sure that the programs and the projects and the collectives that we're building do intentionally work towards a more nimble and flexible model that allows us to be able to shift and move as pandemics or emergencies move us through that, and that we need to be responsive and change when change is needed. And so I won't speak too much on Cura because there's a lot of information that folks can find on our website, but also reaching out to us. But the importance of that project is a collaborative between many different organizations, some which are represented in this space currently, and others that are out there right now doing their thing. And so the importance of constant and consistent communication, building and finding the gaps even within our own internal systems is extremely important. This is not an egotistical part of work, but it's a humbled process of where we need to grow and develop. We need to be able to address that as we are literally building something that wasn't here before. And so the last thing I'll just add is that, the promotoras that shared, that pyramid, right? That there was these stressors and challenges, how we cope. And then from there, what is the community advice? In that Pura and the COC and a collective of collectives is working actively to make sure that we're doing our work to address these different things that were mentioned earlier. So thank you all.
Thank you, Javi and Stephanie and Jenny for sharing a bit about that. So one of the things that I heard you all say is who's at the table, who's helping with this decision making. Community is going to do what community is going to do regardless of funding. They're going to respond to better support each other and one another. So this brings me to my question for Angeles y Sabina. And this is where I'd like to remind you all, because I do switch between English and Spanish sometimes. So if you don't have your interpretation turned on, make sure to have your preferred language turned on, please. So para Ángeles, Sabina y también para Carissa, los promotores y community health workers siempre han estado aquí en nuestra comunidad por décadas. No es algo nuevo que está sucediendo ni nada de eso. Y la pregunta que tengo para ustedes es, y han sido una parte muy importante en todos nuestros tipos de desastres que hemos tenido. So, la pregunta que tengo es si por favor podrían compartir algunas de las actividades que han hecho para ayudar con responder a las necesidades de COVID, ya sea aislamiento o cuarentena o vacunas o lo que sea que hayan hecho para la comunidad y para apoyar lo que está pasando ahorita. Y quien guste, Ángeles, Sabina o Carissa, quien guste entrar al espacio primero.
Ok, yo tenía cambiado mi idioma aquí, estaba escuchando en inglés. ¿Sí puedes repetirme la pregunta, por favor?
Sí, claro. La pregunta es, si pueden compartir con nosotros, porque las promotores siempre han sido una parte muy importante de nuestra comunidad, ya sea para dar información sobre salud o desastres y ahora la pandemia. Si podría compartir con nuestra audiencia cuáles son algunas de las cosas que ustedes han estado involucradas en hacer para responder a cuarentena o aislamiento o vacunas o lo que sea y de qué manera están trabajando en la comunidad.
Claro que sí, puedo ir yo. Básicamente, una de las cosas más importantes que hemos estado trabajando, especialmente trabajando con Cura, porque este es un proyecto de respuesta y ayuda urgente precisamente a la pandemia, ofreciendo diferentes recursos a la comunidad hispana y de bajos recursos. Ha sido un apoyo muy grande para la gente porque regularmente la comunidad hispana ha sido de las más impactadas en esta pandemia. Entonces nosotros como promotoras de salud tenemos más herramientas para ayudar a la gente. Ha sido, la verdad, algo muy bueno para nosotros como promotores, en mi caso, trabajar con Cura, para ofrecer a la gente ese apoyo que necesita. Sabemos que no es suficiente, nunca va a ser suficiente, pero es un alivio muy grande cuando a las familias que pudimos ver impactadas, la mayoría de las personas enfermas fueron familias completas en sus hogares y el ayuda un poquito de ayuda no solamente financiera, pero también de ayuda de salud mental y de decirles dónde estaban haciendo las pruebas gratis o dónde podían buscar este tipo de recursos. Era un alivio muy grande para ellos. Mucha gente decía, pero nunca sabíamos, nunca supimos que estas ayudas estaban allí. Fue un poquito muy duro, pero fue un poquito complicado para nosotros alcanzar, por ejemplo, las comunidades, no nada más de Santa Rosa, pero en Windsor, en Hillsborough, porque no podíamos abarcar todo, pero yo creo que fue muy bueno este proyecto que apoyó a muchísimas familias y también a nosotras como promotoras estuvimos trabajando muy duro para alcanzar la mayor cantidad de gente que fuera beneficiada.
Gracias, Ángeles. Sabrina, ¿gusta agregar algo sobre su experiencia?
Sí. Adelante. Sí, sí me escuchan, ¿verdad?
Sí.
Sí, pues, ok, gracias. Bueno, yo soy Sabina González, representando a miembro de Líderes Campesinas. Bueno, en mi experiencia de 30 años de promotora comunitaria y ahora promotora de salud, yo a partir de los incendios tuve, bueno, un impacto muy grande, ¿verdad? Porque yo en mi experiencia, yo he estado en la comunidad, ¿verdad? Pues llevando información a las personas, pero nunca de esta magnitud como empezando los incendios. A partir de los incendios, pues vi también la gran necesidad, ¿verdad? Porque la necesidad siempre ha visto para nuestra comunidad, especialmente para los latinos, ¿verdad? Que no tenemos mucha información. Pero a partir de los incendios yo me di cuenta de toda esa necesidad que hay para la comunidad, ¿verdad? Y que no se le había podido dar o llegar. Pero lo que también me impactó fue la unión, la colaboración de organizaciones que yo incluso en tantos años no sabía que ahí existían esas organizaciones, ¿verdad? Y ahí me di cuenta, fui descubriendo la magnitud de tantas organizaciones, ¿verdad? Pero ¿qué es lo que nos hacía falta? Yo creo era una colaboración de todas las organizaciones, unirnos, porque en realidad pues es para lo mismo, ¿no? Para nuestra comunidad. Entonces, entre más unidos estemos, yo creo que el impacto de ayudar es más grande. Y después de los incendios, ¿por qué vino? Lo del COVID, ¿verdad? Y bueno, nosotros como esta organización, pero también nos llegó la oportunidad de colaborar con otra organización, que fue este proyecto Cura. Y ahí también me di cuenta, ¿verdad? Que teníamos mucho trabajo por hacer para la comunidad, especialmente la información, porque tanta gente desesperada que no sabían qué hacer, porque se quedaron sin trabajo. ¿Cuántos meses pasaron sin trabajar y la gente estaba preocupada? Y ahí también, en lo personal, descubrí yo que mucha gente pues estaban enfermando psicológicamente, ¿verdad? Entonces, no tanto económicamente, pero también mentalmente se estaban enfermando. Pero gracias a este proyecto de cura, que pues nosotros como líderes campesinas colaboramos con ellos y pues les dábamos esa información a las personas, ¿verdad? Había personas que decían, oh, gracias, no sabíamos que pues había esta ayuda, ¿verdad? Porque a veces incluso en los mismos trabajos no les daban la información. Muchos trabajadores vinieron y se quejaron, yo les di información porque no estuvieron trabajando y no les pagaron. Y yo les decía, tienen sus derechos ustedes como trabajadores, pero tristemente, pues como no sabían sus derechos, pues no podían reclamar. Entonces nosotros como promotoras, yo creo que jugamos un papel muy, muy importante en estas situaciones que estamos pasando ahorita, ¿verdad? Porque nosotros somos la voz, somos el puente para nuestra comunidad. Y yo creo que entre más unidos estemos como organización, como individuos, como promotores, yo creo que el trabajo va a ser más excelente para todos.
Muchas gracias, Sabina. Y se lo va a pasar a Carissa, que sé que el Centro de Center for Wellbeing ha estado trabajando muy cercamente antes de la pandemia, durante la pandemia, y están ayudando a coordinar todo esto. So, Carissa.
Thank you. I think because of the pandemic, there's a sudden recognition of the power of community health workers, but this isn't something that's new. Community health workers have been lifting up our community for decades and decades and decades. And this comes from the recognition that there are gross health inequities in Sonoma County. And this isn't something that just started with the pandemic. This isn't something that just started with the floods and the fires, but this has existed for years. Poverty is a huge driver of inequities. Historic and systemic racism is a driver of these inequities. And this is one of the things that our community leaders as community health workers can really address, is within their neighborhoods, within their places of work, within their places of worship, within the places that they study and live, they're able to really connect with their friends and their families and neighbors and lift up their concerns and provide access to information. And so the topics are vast. It can be anything from understanding what resources exist in the community. We know that food insecurity is a huge issue in Sonoma County. And in part, it's because Sonoma County is one of the most expensive places to live. A study came out that a family of 4 in 2019 would have to earn $110,000 to survive. And we know that we're not there. Just the median income is about half that. And then for Latinx communities, for Latinx household, even less. And so community health workers are able to connect people to resources. They're able to provide education and access. And they are the single greatest driver of promoting health equity in our community. We know that our organizations were often bound within our 4 walls. Our health systems are limited and constrained by so many different things. They don't have the resources to get out into the community the way that community health workers do. But one thing that is incredibly important is making sure that there is recognition of the power of community health workers, recognition and acknowledgement that they are the drivers of change. And that us as CBOs are there to support, to advocate, to empower, but recognizing that they are the ones with the expertise and the knowledge of the needs of their community. And so it's a privilege and honor to be able to work in this space.
Thank you so much. And before I continue on with my questions, I'd actually like to invite the public. If you all have any questions, please drop them in the chat. And I'm happy to incorporate them as we continue asking our panelists some of the questions of what they're seeing, how they're supporting, and how they're navigating the pandemic alongside community. So while some questions come through, I would like to ask some specific questions, right? Because we have our little diagram on how things work and how we work together, and how we continue to work together to really move into community ownership and better support our communities. So I'm going to kick it off with Jenny. The question that I have for you, just because I know that you've been working closely with Raíces Collective, and Raíces definitely have played an integral part in some of the pop-up responses, especially when we were tiered. Can you speak a little bit about how that work has unfolded, and some learnings and or efforts that have happened behind the scenes?
Yeah, absolutely. I think the vaccine rollout, like the initial vaccine, we're in the middle of another one, just to put that out there, but the initial vaccine rollout and the prioritization tiers really highlights how collective work is needed, and really highlights the siloing that happens amongst all organizations and health systems. And so the model that Griselda kind of mentioned that we kind of use to work together highlights a couple things. So I'm going to say those and then I'm going to answer your question, Griselda. Obviously the direct community outreach, which is what Sabina and Angeles and Carissa talked about, which is key and essential. There's resource navigation, right, where Cura and all of the promotores helped with. There's health campaigns and messaging, which I'm going to talk about now, and then there's advocacy. So advocacy being a central role to like all of this. And so a lot of what we realize is that, and community knows this, that our health systems and our county don't actually message well to community, right? There's a lot of well-founded trust and mistrust with government as well as with health institutions after decades and generations of maltreatment and systemic racism. And so Raíces Collective did an amazing job bringing together local artists to create messaging by community for community. And I'm sure you've all seen this incredible artwork, which really, really does help spread messages of trust. And then even more importantly, Raíces has really led the way in doing these community-led, community-based pop-up events where community identifies areas or holidays or special times where community is getting together, and then Raíces has been able to support the pop-up of vaccine and healthcare events where other community-based organizations have tabled. They bring in music, they bring in food, they bring in volunteer health professionals that are able to talk to community and address again valid concerns and doubts that people have about vaccines, and bringing that all together, right, in order to really meet community where they are. And it has made an incredible difference. The one other piece of the question that you asked are things that we've learned. And one key takeaway I would say is the more that we as systems can empower community and community-based organizations to do that type of health campaigns, and the way that they've shown that we can integrate that into our own messaging and our own campaigns, that is key. And just to put out there that every step of the way, funding and all of that is still within that same structure of structural racism. And so every time there's an incredible movement and idea, the answer is okay, write up a proposal. Okay, all right, twist yourselves as a CBO to be able to get this particular grant, right? Which kind of takes away the focus of the actual community work that there is. And so there's been some things that have come out of this, such as unrestricted funding, for example, so that promotores and artists can actually get paid to do this work. So I think those are some of the really beautiful key takeaways that have come up. And again, a huge shout out to Raíces and all the work that they continue to do almost every weekend.
Thank you, Jenny. And totally, yes, I've attended a few of them, and I see folks from LSP, our promotoras from Cura, and others. So it really takes that collective effort to meet our community where they're at. I'm gonna toss it over to Stephanie. Oh, and actually, before I toss it over to Stephanie, there is a question in the chat that says, are underserved folks in the community able to get tests easily? And I'll pass it over to Dr. Jenny so she can tell us a little bit about that, because I know that Raíces has also kind of supported in some of that, but then there are other places where advocacy is happening.
I'm sure everybody in this group has a lot to say about testing. And what I can say is that we were way behind.
Oh no. Did she freeze? Yes. Okay. Would any one of our panelists like to address that question while we get Jenny back?
Stephanie, did you want to go first? Did you have anything you wanted to share?
Yeah, and it's a great question, definitely, about testing. And I think where Dr. Fish was maybe going to go is that we were definitely behind the curve when it came to testing in Sonoma County. We look at other nearby counties like Marin County, Napa County, and things moved very differently there in comparison to Sonoma County. And unfortunately, we're still behind. We're still really dealing with a lot of the consequences of being behind early on. And so there are organizations and promotoras who are doing their absolute best to let people know where they can go and get free testing. And it's a huge effort. And a lot of the times the barrier that we come up with in our advocacy is that there just aren't enough tests, which is really unfortunate. And again, it goes back to us being behind the curve to begin with. And I don't know, Javi, if there's something else you'd like to add.
I would just say, yeah, from the start, it's been a large challenge for, I think, many organizations and promotores and promotoras. And being able to get consistency is a huge challenge, right? Depending on whether we're in a surge or not. Capacity is a huge issue, right? Not enough resources, not enough individuals that are able to actually administer or do the PCR tests. With antigen tests, right? There's another layer in that. And there's the conversation, and this was brought up earlier by Dr. Jenny Fish, is particularly around the communication between institutions. Both we're talking about the federally qualified health centers, the county, and the different departments, and then CBOs and community folks, right? And so that conversation and that partnership between all of those is still not at a full collective process yet. And so that's where we're still seeing some of the issues of we're not always communicating with each other in the same room about the same information, which then that's where some of the confusion starts, the lack of the understanding of on the ground challenges and issues. And so we have created spaces where also what Dr. Jenny Fish had laid out was advocacy. How do we continue to advocate? And that's what we're doing now and before around testing. Cura, in partnership with ISOCare and with West County Health Centers, we're piloting an antigen test site in Sebastopol right now with limited capacity because the antigen tests that the county have access to are expiring. So that it's an example of, you know, how do we take this into our own hands of trying to make sure that we can at least do something to fill the gap before, you know, there is a transition or there is additional support. Sorry, Jenny, we kind of went off. If there was anything else you wanted to share.
Nope, you all got it. Thank you so much for jumping in.
Nice. So what I'm hearing is that health really goes beyond the four walls of the health centers, the hospitals. It really is living, breathing in community. So Angeles, Sabina, and Carissa, I'd love to hear from Angeles and Sabina what has worked in regards to, you know, supporting with health information. And then Carissa, what from the provider perspective and or the CBO perspective, how do you all continue to unfold training and development to have accurate information? So vamos primero con Ángeles y Sabina and then with Carissa.
¿Puedo responder yo?
Sí, claro.
Sí, soy una mujer que ha trabajado en la comunidad muy de cerca con las medicina alternativa como las plantas medicinales y también la nutrición. Por 8 años he trabajado en la comunidad de Rockland, trabajando con remedios caseros para ayudar a la comunidad para cada año tenemos el problema de las influencias, de los resfriados. Y la gente no tiene la capacidad para tener una aseguranza médica y atenderse. Y he podido ver que esto ha hecho un cambio muy grande, al menos en esa comunidad, porque la gente utiliza los medios que tiene como los test y sobre todo para prevenir.
Gracias, Ángeles.
Entonces, una de las cosas que ha funcionado desde mi perspectiva especialmente en esa comunidad, es aprender, es la educación, es practicar, es enseñar, es tener accesos, opciones donde la gente pueda hacerlo fácilmente. Y yo he podido ver en estos 8 años que la gente puede tener una mejor perspectiva de salud, puede ayudar a otros también a tener una mejor estilo de vida cuando tiene la información correcta.
Gracias. Y lo que estoy notando es que en el botón de interpretación, disculpen, no se interpretó necesariamente en inglés. Vamos, es información muy importante. Vamos a seguir con Sabina y si gustas agregar, Sabina, me gustaría si las personas que hablan inglés podrían estar en el canal de inglés y ahí Mariana podría transmitir. Gracias.
Sí, no escuché mucho, pero creo que dijeron, ¿verdad? Que yo que era algo. Sí, bueno, yo en la experiencia, ¿verdad? Que he tenido, pues más que nada necesitamos más capacitación como promotoras de salud, ¿verdad? Para poder pues llevar a nuestra comunidad, ¿no? Entonces la educación es lo primordial para una promotora de salud y pues yo creo que es lo que estamos haciendo ahorita porque hemos tenido algunos, bueno, yo diría varios entrenamientos, ¿verdad? Las promotoras que han, organizaciones que nos han invitado, que nos han dado esos entrenamientos y que nos han ayudado porque de hecho nosotros como líderes campesinas siempre trabajamos con las trabajadoras y trabajadores del campo, porque a pesar de que somos una organización de mujeres, pero también tenemos apoyando también a los campesinos, ¿verdad? Y nuestro enfoque es siempre estar en los campos porque son los lugares donde no llega mucho la información, porque yo diría que están como un poquito más marginados de información, ¿verdad? Entonces lo que hacemos nosotros es llevarle la información al campo y también ahorita pues les decimos la importancia que es la vacuna con flyers, les damos los flyers que nos dan, ¿verdad? Para que ellos los lean y les decimos cuál es la importancia, dónde pueden ir en caso de que se llegaran a enfermar y no tengan un seguro médico, porque más que nada también ese es uno de los obstáculos muy, muy grandes para nuestra comunidad latina, el no tener un seguro social, el no tener los documentos, el no tener una aseguranza médica, les da miedo ir. Entonces, ¿qué hacemos nosotros como promotoras? Les damos los recursos a donde pueden ir, ¿verdad? Y para eso nos preparamos para tener como un directorio de esos servicios, para nosotros mandarlos directamente ahí, ¿verdad? A donde ellos sí pueden agarrar esos servicios. Y pues sí, yo creo que sí se han beneficiado muchas personas, especialmente, yo digo, a los del campo, porque son los que no tienen mucha información. Incluso cuando vamos a ferias de salud, pues, ¿verdad? Siempre tratamos de preguntarles si trabajan en el campo o pues para decirle las ayudas también que ellos como trabajadores del campo tienen, porque pues son los que no saben de mucha información. Y nosotros como promotoras creo que nos estamos educando muy bien para llevar esa información. Hacemos el puente para darles ese acceso a las personas y referirlas a donde puedan ellos ir, ¿verdad? Entonces, pues yo creo que es muy importante que nos sigamos educando como promotoras de salud.
Gracias, Sabina. Y pasamos con Carissa.
Thank you. Yeah, anytime that we're kind of capacity building or lifting up the information that community health workers can give, there's the what and there's the how. So the what is constantly changing, especially with health. If we just look at nutrition, for example, one day eggs are great, the next day eggs are bad. There's all this aggressive marketing around, what's the new fad diet pill? I know that in the pandemic, there's been so much aggressive marketing on social media for all these different products you can buy. And so it's important that we stay up to date. And then, of course, with the pandemic, with COVID, there's constant learning for all of us. I mean, this is a novel virus, and it's not something that we were immediately equipped with how to navigate or how to provide information. And there's a lot of distrust and there's a lot of misinformation. So luckily, there's emerged several touch points on a weekly basis for those that are doing this important work to be able to get current information, to really build their knowledge around that. But then there's also the how. How do you build trust in community? How do you engage somebody? How do you open a space to hold somebody in their vulnerability and their trauma in that compassionate way so that they feel safe to reveal what their needs are? So much of what we talked about is kind of identifying gaps in what people have access to and then linking them to those resources. But it is a vulnerable place to say, you know what, I don't have enough to feed my family, or I'm struggling with elder care or child care. And so really, and it's not always intuitive. When we're caretakers, we want to problem solve. And sometimes you have to withhold your advice. You just have to sit and listen. And that empathetic listening and that motivational interviewing, that questioning, those are really the skills that we also help build to really help people create this space of safety and support. So it's great that the community has come together, and again, so many different opportunities and different CBOs with our providers, with our county, to be able to provide these training opportunities.
Thank you all. And I do want to just do a quick time check. And I know that, I could spend all day learning from you all and hearing, what our community continues to do and prosper in. But just to close out our session today, in your opinion, what have been 2 key learnings that can go beyond COVID and that our partners like clinics, hospitals, and others can support with? So if any of you would like
I can go first. Something that's been touched on a little bit that I'd just like to highlight in these last couple of minutes is that this work takes resources. It takes staff time from community-based organizations. It takes the boots on the ground work from promotoras. So a lot of this work, it's very underfunded. And something that Dr. Fish talked about earlier is that there has been an opportunity to really explore and even create models around what financing a promotor program could look like. And so that's been a really key learning, at least on my end, and something that I would like to see be a sustained effort in Sonoma County. I mean, we have emergencies every year and we don't know what's going to come next, but what we do have is an amazing network of promotoras, organizations, partners that are ready to do this work, but it requires resources.
I can actually piggyback on that. I think one of the learnings that we have is that we need immigration reform because that's one of the limitations is as a CBO, we can get funded and inject that funding into the community to do this work, but we have certain barriers and limitations. So we have financial audits every year. So we have to show if anybody is an employee or a temporary employee or contractor, what their documentation status is. And it is so frustrating not to be able to fund everyone that's doing this or only funding in a limited capacity. And that's one of the beautiful things that has come through these collaborations is we're really looking at how do we address those barriers? How is it, for example, if a CBO can stipend anyone up to a calendar year for $500, if we can pass the baton and take this on as a collective of organizations to be able to have funding pathways for the individuals that would volunteer to do this important work, but that's not equitable. They need to be funded for this. And so immigration reform is a huge need.
I think I'll add some of the key learnings around how do we balance urgency and process is something that has been profound in not only during this pandemic, but what was already present prior during other emergencies at the start of now what we call fire season. And so there's a reality of there's privilege, and then there's areas of not so much privilege, right? The privilege of being able to potentially get funding, but then the lack of time for process and engagement and ownership by community to then make decisions in a way that allows for all of us to be on the same page. And so that's been a huge, huge learning, at least for me, about how much that actually takes, not only in multiple agencies or individuals holding that space, but the time it takes. And that, an 1.5-hour meeting each week doesn't always suffice. And sometimes things get really done pretty quickly, and then other things that really need months and maybe even years to build and construct so that it's really holding everybody in Sonoma County, which we have not reached yet as a collective in Sonoma County, that is for sure. And that we are on a trajectory to do that. We just know that, as Stephanie shared, the amount of what that takes in funding and capacity is huge. So just wanted to add that.
And I want to throw in, before we open to questions, I also want to throw in there for all of the folks that are watching this or that will watch this that are health professionals. One key learning is you do not have to be an expert to engage with community and to advocate with CBOs and to step in front of the Board of Supervisors or the county. Like, I'm not an expert, and I'm eternally grateful for all the folks that you see in front of you for allowing me to be able to build trust or have them build trust with me. They are the lead, right? Community health workers, community members, the leaders of community-based organizations are already the experts. And all we need to do is show up and follow their lead, and it makes an incredible difference. And it's a way that we can use our privilege and our positionality within our society to really make equitable change. So that's the learning that I'd put out there for all of you that are working in health systems.
Thank you, Jenny. What about Angeles and Sabina? What are 2 key learnings that you'd like to share with our audience, with our community and others?
Pues he estado escuchando a todos los que están aquí en este panel y es importante lo que ellos están diciendo, pero yo más bien me enfocaría en que para poder construir algo estable que pueda ayudar a la comunidad es que entendamos que todos de alguna manera podemos ser promotores de salud. Todos podemos ayudar a alguien. No podemos etiquetar nada más y esperanzarnos en 1 o 2 o 3 personas. Podemos ser promotores de salud porque el promotor de salud es cuestión del corazón, es cuestión de querer ayudar. Entonces, entre más promotores de corazón y de compasión, podemos tener un mundo mejor. Los promotores queremos y soñamos con un mundo mejor.
Sí, perdón. Sí, pues yo, ¿verdad? En lo personal, pues como les digo, en mis 3 décadas de ser una promotora comunitaria y ahora promotora de salud, pues más que nada, como dijo mi compañera, sentirlo del corazón, ¿verdad? Porque siempre por décadas he sido una voluntaria, promotora voluntaria, le podría yo llamar, pero debemos de tener humanidad, más que nada, ¿verdad? Para poder ayudar que nos salga, que lo sentamos, o sea, que lo sientamos desde nuestro corazón para poderlo hacer. Tal vez no necesitemos que nos den un pago, sino es algo que lo sentimos para poder ayudar a otras personas, o como decimos en palabras sin ofender, ¿verdad? Ayudar al prójimo, pero que uno lo sienta desde lo profundo de su corazón. Y yo creo que eso es lo más importante, y como dijo, todos los podemos hacer, pero siempre y cuando lo sientamos de corazón.
Bueno, muchísimas gracias a todas y con eso se lo voy a pasar a Pam. Gracias a todos, todas por estar aquí hoy.
Thank you for the wonderful panel, everybody. And these were really, really great questions. A lot of stuff that has been on the minds of people in the community, and to be able to share exactly what's been going on. I know that's always a really key thing that happens all the time, right? We have the community, we have the organizations and the partners doing the work, and it's just nice to have a place to really hear what's going on, who's doing what, and it's just like a way to make sure everybody's connected, right, with the appropriate knowledge. So thank you all so much for joining us. I will just say we are going to continue this series for the rest of the week, as you all may know, and so we will be having some workshops for the rest of the week. And just so people are aware, we will have this broadcast recording of today's workshop at KBBF tonight at 8 p.m. So please tune in for that. We talked about equity. A lot of people don't have the noontime, lunchtime to be able to join in and listen to this. So just so it's a little bit more accessible for folks, it will be again tonight at 8 p.m. at KBBF 89.1 FM or kbbf.org. So I will hand it over to Dr. Gonzalez, who will talk to us about the workshop for tomorrow.
Thank you. Gracias. What an amazing panel. And I think that among other things, promotoras can be mentors for the young people, because you can be an example of helping the community, doing something that you enjoyed, and help someone. So thank you very much. Thank you to the panelists, and we hope to see you next year and see you in person, hopefully, at Sonoma State. Thank you. Well, tomorrow, October 13, we have Dr. Jeff Reynoso. I know him, and even if he's such a young man, he's been doing wonderful things. He's the director of a very interesting organization that is the California Health, what is it? California Coalition for
Healthy California.
Latino Coalition of Healthy California. And the Latino Coalition of Healthy California is working a lot in policies, and they are pushing in Sacramento, and they pushing in Washington, because it's a very strong organization at the state level. So he will talk about protecting and advancing Latinx health equity during the COVID-19. And also, well, he's going to talk about how they work in order to be more effective to the politicians, in order to improve the equity among Latinos. So we'll see you tomorrow at 12, and I hope we can have the amazing thing that Dr. Fish organized today, that is someone to have an interpretation of in English and Spanish. It will be wonderful. And we'll see you tomorrow. Thank you very much, and take care.
Thank you, everybody.
Adios.
Adios.